So anyone who has had the hopefully fortunate, possibly unfortunate experience of asking me about my laser understands how excited I get about this technology. I think it's amazing. It's this perfect marriage of science into the art of dentistry. It's really, really awesome. So what happens is when the child comes into the operatory, it's all normal, up until the point where I would be giving them local anesthetic. And then at that point, instead of using this little fluid that goes in and works with the nerves to help the kiddo not feel sensation, I get to pick up my great laser. And when I aim my laser at the tooth, what it does is it works with the nerves underneath the tooth. And it's very focused, so meaning that I can just numb, and it does it again just under the spot where I'm pointing the laser. So the whole rest of the tooth still retains normal sensation, which as a dentist is a dream, because at the very end we ask people, anybody who's had dental work knows, they ask you to bite on it so that we can tell, is your bite on, is your bite off? If you're all numb, are you really biting the way that you normally would? Probably not. But when you're not numb with the laser, you can get a really great accurate bite. So I almost never now have patients that need to come back for me to adjust their fillings just because they're able to bite well at the very end of it. So I squirt their tooth with this awesome laser energy. What it feels like, I tell them, is just water. And we always show it to the kids beforehand, and we call it our airplane. Because on the settings that we use to get your teeth nice and numb, it sounds like a drone. Sounds like, and that kind of starts the process of taking away the decay. And then I finish it up with the old traditional dentistry of just smoothing everything out and making it beautiful and wonderful. And then I'm able to put the filling in, and all of this is with no anesthetic, which the first couple of times I did it, I have to say, was very scary. I asked the patient about every 3 seconds, are you sure you're fine? You don't feel anything? No, it's still good. But I can say it really works very well, and they don't need any type of anesthetic.